And that means a driving sense of purpose. What are you going to change? How are you going to change it? We've got 5 missions. The first one is really important, which is growing the economy, which means making people feel better off, which is why the choices that we made yesterday in the budget are so important, making sure that we're protecting working people so that in your pay slips and the pay slips of millions of people across the country, you're not going to see an increase in what you have to pay, because we're not going to be able to lift living standards unless we make that basic protection. But one of the other missions, and there's only 5, is the NHS, and the mission there is to pick the NHS up, to get those 40,000 appointments and treatments done every week, to get the waiting lists down, but to do more than that, actually to make sure the NHS is fit for the future. We look back very proudly at the Labour government after the war, which created the NHS in the first place. I think given where things have got to, we now need the 2024 Labour government to pick the NHS up, reimagine it and make sure that it's absolutely fit for the future. And you'll be doing that with us, because we want to hear from you about this. We've got a 10-year plan for the NHS, the change we're going to bring about, and we need your ideas. I'm a big believer in listening to people who are doing the job to get the best ideas about how we can do the job better, and that's been reinforced by the discussions that we've had here in this hospital this morning. Obviously, it was really important yesterday for us to put more money into the NHS to make sure day to day we can relieve some of the pressure, allow you to get on with the job that you need to get on with. You don't need us to tell you how important that is. Also put in more money on capital for the longer term, the changes, the technology that you're going to need. All of that has to be done with reform and change at the same time. And what do we mean by that? We mean making much better use of technical work, AI, digital, etc. Huge opportunities there for us to move quicker and do more. Secondly, to move to a preventative model where we're catching things earlier on. Now, you will all know the worth of this. You know, just this morning we're talking about people with heart problems, don't know they've got heart problems, could have been picked up much earlier, wouldn't have been in A&E, probably wouldn't have been in hospital for 3 weeks, would have been in here or a hospital like this being treated much more quickly. So preventative is really important. And then the other big change will be to make sure people can access healthcare closer to where they are in their communities, so that, again, that can really help on the preventative side. Pharmacists doing a lot more. So there's a lot of change. We need you to help us with that change, because that reform needs to happen. But the ambition here is to make sure that we can say, we've got the NHS back on its feet, which everybody desperately needs and everybody desperately wants, but also an NHS which is truly fit for the future, and where you can really look at pride at not just the everyday work that you could do, but the fact that your fingerprints are going to be on the model for the NHS for the future, which is a great thing to do. I mean, if you look back at those that were the first people working in the NHS who shaped it for so many years, this is our opportunity to do the same. And what we're trying to do is, we inherited a pretty bad situation with the budget. There's not much money left in the economy. Some of the money that should have been accounted for wasn't accounted for, so we've had to make difficult decisions. £22 billion worth of money which wasn't on the books back in March when the last government did the sums. We've had to deal with all of that. That's obviously a challenge, but let's use it as an opportunity to say, well, in which case, let's be mission-driven. Let's make sure that we get the NHS where it needs to be. I look forward to working with you on that journey. So thank you very much. We're going to now take some questions from you. I think any of you can ask any question. It does, on the NHS, it's absolutely fine. It doesn't have to be on the NHS. You can ask us anything you like. Well, within reason. The cameras are rolling, but you know what I mean. So where should we go? Yeah.
Hi, I'm Dr. Amy Burbridge. I'm a consultant in acute medicine.
Oh, yeah.
Hi, Dr. Amy Burbridge. I'm a consultant in acute medicine. I've been working in the NHS for 19 years. Thank you for the increased funding. It's incredibly welcome at a very difficult time. Now, my main concern is physician wellbeing and burnout, particularly amongst our resident doctors. Now, you've announced these huge amount of income that's coming to the NHS. How can we be assured that that income will translate to staffing gaps that we've got, the increasing number of rota gaps, that over the winter, we're not going to be really stretched. We're not going to be working in A&E with short-staffed. We're not going to be working in acute medicine, having to cover lots of different areas, which is incredibly challenging. Patient safety is at risk.
Yeah.
How can we have some assurance that, the money will go towards that?
Well, thank you for raising that, because that will be on everybody's mind, wherever they're working in the NHS. There's been a huge strain on for a number of years. Obviously, COVID was very, very impactful. And then the very fact of having waiting lists that are very high is not a good environment for people to work in. And also being undervalued, quite frankly. When the last government wasn't able to bring down the waiting list, who did it blame? It blamed you. Yeah. And that is disrespectful. That undervalues what you're doing. So the first thing, it's not a complete answer, is a mindset change. Actually, some basic respect. My wife, as you may know, works in the NHS in one of the big London hospitals, so the morale of the staff is a sort of daily conversation. But it is really important, because guess what? If you value your workforce and treat them properly, then it actually works better across the piece. But we do need to back that up with a workforce plan to make sure we've got the right sort of cavalry coming through to fill the places that are needed, and really go much, much faster on the technology that you need to take some of the weight off you. Now, look, I'm not going to pretend that by next week it'll all be fixed, because too many politicians have done that. It's going to take time, but what we did in the budget yesterday is the first step, the down payment, if you like, down that road to make sure that you can do your jobs better and we can have the NHS that we need. Rachel, was there anything you wanted to add to that? Let's go, yeah. I need to remember to look behind me as well.
Matthew Pryor, Deputy Director of Pharmacy. So pharmacy teams and their fantastic work is historically underutilised across the NHS, especially as our expertise, skills and scope in legislation grows. So within secondary care, how does the government plan to utilise pharmacists, pharmacy technicians and pharmacy assistants to improve patient outcomes, experience and ultimately reduce some of the work burden on other healthcare professionals as well?
This is such a good question, because we can make much better use of our pharmacists. It's an example of the preventative bit and the neighbourhood bit, the neighbourhood health service, if you like. There are plenty of examples, and I'll turn to Rachel in just a minute. But this morning, we were looking at some of the work done in this hospital in relation to valves in the heart and their replacement. Incredible work we're just seeing with your team here. And one of the points they made to us was that with a stethoscope and AI working together, you could probably pick up the people who needed some of this treatment much, much earlier. And we were talking about whether that could be done. I assumed GP, and they said, no, you could actually get it done in the pharmacist. So that would be an example where quite a simple procedure, listening to your heart, with AI to help, get much more quickly to the root of the problem, then, in a necessary case, pass the person on much more quickly. Huge benefit, because people are going to be in the pharmacist for all sorts of reasons. Fast-tracking into where they're needed if they're needing it, cutting out the A&E bit, which then takes the pressure off your colleagues, because that's where a lot of the pressure is. And so it's an example. There are others, vaccines, etc. But Rachel, I think this is an area we really want to push hard on.
Yes, so yesterday in the budget we did a spending review to settle budgets for this year and next year, but late next spring we'll be doing settlements for at least another couple of years after that, and capital budgets for 5 years. And so we've now got this sort of breathing space for the next 6 months to work on the second stage of the spending review. And what I don't want to do is just put more money into doing more of the same. I want to do things differently, because we don't want to get to the end of 5 years of our government and think, well, we did everything that was happening, but just a little bit more, because I think we could do better than that. And certainly from all the conversations that we've had here with staff, and that I had at St George's Hospital in South London in Tooting earlier the week with the Health Secretary, that all of you are buzzing with ideas about how we could do things differently, get better value for money and better outcomes for patients as well. And that's why why Keir and Wes launched last week the consultation, so that we can hear directly from patients and staff, so that we can see the best things that are happening at the hospital here in Coventry and make sure that they're happening in other trusts. But similarly, there'll be stuff happening in Leeds, where I'm an MP, that could also be useful in other trusts around the country. So sharing that best practice, and this consultation is a really key part of that, leading up to the next spending review.
But these two questions are linked.
Yeah.
Because if it's possible to identify people before they present to A&E, then obviously for the patient that is a whole lot better, but it also takes the pressure off your colleagues, because people are presenting at A&E who could have been pulled out of the system, as it were, and treated in a different way at the right place without having to resort to A&E, then reduces the pressure. So we've got to look at this in the round. It's not, is this job here at the expense of that job there? It's actually joining this up, and then, as Rachel rightly says, doing it across the piece. Let's go to another question. Yes.
Thank you, Prime Minister. I was really pleased to hear your words about valuing the NHS workforce in response to my colleague. I'm a cardiologist. I've been working in the NHS for a while. What we've seen for the last few years is increasing pressure, increasing environments where staff feel that they're being worked harder and harder, and the burnout question comes back again. And I wondered if part of this is a cultural change. My concern is that we're going to, with a focus on increased productivity that we're inevitably going to be looking at, and AI will help with that, but there's going to be even more pressure on staff to deliver more and more. Is the government going to have a focus on cultural change within the NHS, so that we're working more as a collaborative team and environment?
Look, thank you for raising that, and let's have a really honest discussion. We need to value staff more than they've been valued by the last government, in my view. And I think it was shocking the last government simply tried to blame the staff for the problems that the government's making. That isn't the way that you get the best out of people, create the environment in which they're having to work, and they're under a huge amount of pressure. In A&E, one of the pressures is we don't have enough scanners with the scan results coming back more quickly. That's where the real problem is, so we need to identify that. But I also want to be honest with you, we are going to be asking more of you. There's no point me standing here and saying your workload will go down. The whole point is people are living longer. They've got more conditions. What the NHS is facing now is different to what it was facing in the post-war period. Your workload is likely to go up, not down. Now, in a way, that is a good thing, because we're living longer. We shouldn't see that as a bad thing, but it does make your life more complicated. So are we making a bigger ask of you? Yes. Are we going to help you, therefore? Yes. Make sure we've got the right trained staff in the right numbers where you need them, making sure that AI and technology is your friend, so that some of the things that can be done better and differently are done. I mean, there are so many examples. The taking of the same details from the same patient over and over again seems to me a repetitive process which we could cut out quite easily. I've spoken to up at Alderhay Hospital to some of the parents whose children were in hospital, and to have to walk through and explain over and over again what had happened to their children was really, they were just so emotionally, they didn't want to walk through again. And so I do think there are things that we can do that which will alleviate the pressure. But are we going to make a bigger ask of you? Yes, because we're really proud of what you do. We want it to be even better. And the demands are going to go up. We can't stop that. That's because we're living longer, etc. But can we, using technology, preventative measures, making sure it's more localised, change the very way in which we carry this out? Yes, we can, and that will take the pressure off. So you're doing more, but actually the pressure will come off if we do it in the way that we need to do it. But that is the reimagining of the NHS. So we don't want to be a government that simply manage the NHS a bit better than the last lot. That isn't our ambition. It's to change in a good sense. I know there's been too much top-down change, in my view, in the last 10 years, which didn't help anybody. You know about the reforms that took place when it were 10, 12 years ago that all had to be reversed. We're not interested in that sort of reform, but genuinely changing the way in which you work by making use of technology, different techniques, using colleagues in a different way, in a collaborative way. That is part of what we're talking about. Rachel, I mean, this is a big part of what you're driving at.
I just want to say a couple of things on this. when I became Chancellor, one of my earliest decisions was whether I was going to accept the recommendations of the independent pay review bodies. Now, the remit was given to them, those pay review bodies, by the previous government, and the previous government had some of those recommendations before the election, but just sat on them. And when I got them, they were already several months late, because you should have had your pay rise in April, and it was already July by then. And I decided to accept in full those recommendations and give public sector workers in the NHS, but also in schools and the police and the armed forces, the first meaningful real terms pay rise in 14 years. And I think that was the right thing to do. It brought industrial action to an end. And to the point that Amy made right at the beginning, I think it is important that we value staff who work so hard properly. So that's one side of making sure that people are properly motivated and respected for the jobs that they do. But also, and again, this is from a story when I was at a different hospital recently, and they said that they were using equipment that should have been replaced 5 or so years ago and had been bought more than a decade ago, and it often didn't work, and it meant they weren't able to do some of the things that I've seen and happening in the hospital here today, and that reduces the productivity and the efficiency of what you're able to do. It's not your fault, but that's the equipment you're having to live with. And one of the reasons that happens is that the previous government always raided the capital budgets to pay for the day-to-day spending. Well, I can understand why, because there's massive pressures today, but it does no good for the next year and the year after if you're not investing in either the hospital building or the capacity with the number of beds, etc., or doing the repairs in hospitals, or you're not buying the diagnostic equipment and scanners and stuff that can make you more productive in your job. So we've got to make those longer-term investments to drive those productivity and efficiency performance as well.
Any more?
Lady behind.
Oh, yeah, excuse me, we're just going to go behind, otherwise we'll never go behind. Yeah.
Hi, I'm Karen McLaughlin. I'm a paediatrician and have been for a very long time. So every week in my clinic, I see probably at least one child now with liver damage secondary to obesity. And they don't need me. What they need is somebody that can take them out and do junior park run or play football with them at lunchtime or walk them to school. How are you going to address that preventative issue? Because my problems that I see now are going to be my colleagues' problems in 10 years' time.
Yeah, I mean, this is part of the preventative piece that we've got to get our arms around, whether it's obesity or anything else. I mean, obesity is the example you give, and it's a really important one in terms of the number of children presenting with some sort of obesity. There are other examples, again, to use the example of Alderhay. I went to the heart ward there. It was most incredible to see 2-year-olds having heart, or just having had heart operation. But I was really, really shocked to know that the single most common cause for admission to Alderhay Children's Hospital for children aged 6 to 10 is to have the teeth taken out because they're decaying. So those brilliant staff, as is brilliant staff here, are being used to do something which is completely preventable. And we have to get to... People who say nanny state, I'm sorry, if the price of intervening or the price of not intervening is a child having his teeth taken out or a child that then has to present to all of your colleagues for the rest of his or her life, then I'm in favour of intervention and doing something about it. And that is a part of what the public health prevention piece is for us as well. It's why we're doing what we're doing in relation to smoking as well. They're difficult decisions and people think that they are nanny state. I think they're common sense and we've got to get on and we've got to do it. Charlotte, can we come to you?
Yes, of course.
Do we need a microphone? And then we'll come across here.
Thank you. So I'm Charlotte. My question will probably follow on a little bit because I'm the public health midwife.
Oh, OK. So working as a tag team.
Unplanned, but so obviously, as we know, the support and care that can be given by midwives and obstetricians through pregnancy, the positive impacts that that can have on child and adult health, you know, are massive, particularly if thinking about preventative measures. Does the government have any plans in terms of focused funding towards maternity? Is that something that, you know, the investment in would allow us to do that a little bit more?
Great.
Yeah, I mean, it's really, both Karen and your question, Charlotte, are really important. And just first of all, just on what Karen was saying, one of the things that we want to do as a government is not just like different parts of the NHS working together and preventative within the NHS, but also different government departments working together. So we can give Wes Streeting and Department of Health as much money as you like, but if we're not having active kids in our schools and children having access to PE and good coaching coaches and all that sort of stuff, then we're not going to be able to tackle some of the issues that you speak about. And similarly, if we're going to get people off sickness benefits and back into work, we need an NHS that is treating people efficiently and quickly. Otherwise, the Department of Work and Pensions budget's just going to go up and up and up. And so we want to do things differently like that as a government, with different ministerial teams working together to make sure that the money is well allocated. Charlotte, I think your point is really, really important as well. The focus of the announcement yesterday was around trying to meet that 18-week target between referral and seeing a consultant in a hospital, but we know there is more that we need to do in the NHS around ambulance waiting times, around A&E, around maternity health as well. We've given this £22.6 billion settlement to NHS England. It's up to then to allocate the funds, but you know, I absolutely recognise the points that you're making.
Then we come over. I'm sure I saw some hands here. Yes.
Hi, Prime Minister.
I think it's on.
My name's Rachel Chapman. I'm public health consultant here, so it's a great theme running through this. So our strategy is to be more than a hospital. So this shift that we're talking about from NHS treatment to more prevention is absolutely music to our ears. I was wondering, can you talk a bit more about what the plans are in terms of how we can contribute to this as part of the NHS, as well as working with our partners?
Yeah, this is really important, because on prevention, on the best things to do, the things that work, you're likely to know more than I do. And therefore, if this is going to be done, it shouldn't be done from Whitehall and Westminster with politicians sitting in a sort of, you know, windowless room trying to work out what prevention is. It's got to come from real live examples. And I'm a massive believer in this. The people who are doing it on the ground will have a really good sense of examples. This really worked. This made a real difference. So what we've got to do is give you and others the opportunity to put those ideas, those good practices on the table. That's what the big consultation that Wes Streeting, the Health Secretary, and I launched about 2 weeks ago. Please use it. Put your ideas in there. They're all being looked at. Make sure we understand what inhibits good practice across different trusts. Because I know that some things are happening in some places, they're really good, but are they happening in every part of the country? My sense at the moment is there's different bits of good in different places around the country, but there's not a consistent good in every place in the country. Now, that may be a matter of collaborating and coordinating. It may be something we need to look at. Is the framework too rigid? Is it too bureaucratic? Does it stop you sharing? Is there, you know, are there things in place that mean something that's actually been quite well tested in one place is having to be redone all over again in the next place, when it could perhaps be passported through more quickly? But this will only work if you put your fingerprints on it. So please make sure that you're feeding in those ideas to us. The mindset is there, the willingness is there. We'll take that on. But the best examples are probably going to come from you. And I mean, when I ran the Crown Prosecution Service, this is as the name suggests, the Prosecution Service for England and Wales, we had 100 offices. And I used to go to every office on a pretty regular basis and talk to the staff and say, what are the 3 biggest challenges or headaches you're facing at the moment? And what's your workaround? Because if you've got a problem in the office, you've normally got a pretty good idea of how you'd actually fix it. And some of the best ideas we came up with were ones that the staff said, to tell you what, if you fix this, it'll make a massive difference to my life and we'll be much more efficient. And so we need to get into that mindset. So thank you very much. I think we've got time for maybe one last question. Oh, we got 3 here. Let's go to you. So let's see if we can pick up 3 very quickly.
Hi, Prime Minister. I'm Ankur. I'm Community Integration Lead. And my question is, as per what you've said, care closer to home, that's what you want. That's what your government want. And I'm part of the community group. Okay. And my key question is, how are your government or your new allocated fund, how would you ensure that they are kind of allocated to community services? Because that's where we want our services to go.
Yeah, let's do all 3 and we'll try to do a sort of, see if we can do a bridging.
Cheers, thank you. I'm Nick Aldridge, the Head of Research Delivery. We know research-active hospitals have better patient outcomes regardless of patients engaging with research. How will we ensure that we continue to offer that and more sites become research-active across the UK?
And Hazel.
Hello, I'm Dr. Cliff. I'm consultants palliative medicine, and I think my question is, we're talking about prevention, but we all know that at some point we're going to die, and how are we going to ensure that we can provide that care and support for patients and their families and those close to them where they wish to be, because a lot of people do die in hospital, and how can we help our health services, social services and also neighbourhoods to support them at where they wish to be?
Yeah. Rachel, do you want to start on any of those?
I might take Nicholas's question around research and using the health service. This is something that myself and Wes Streeting, but also our Digital Science and Innovation Secretary of State, Peter Keir, is really interested in. We held an International Investment Summit in London a couple of weeks ago, where we had some of the biggest investors from around the world come to the UK. And one of the big pharmaceutical companies announced a trial that they were going to be doing in Manchester. Now, the reason they like doing trials in the UK is because of our National Health Service, that people from all different backgrounds, all income levels, all different ethnicities are treated on the National Health Service, and that means you've got a really rich environment for doing that research and access to data. But we need to do better in enabling that data to be used for those sorts of things, because it means that new drugs, new medicines can be trialled here in the UK with better outcome for patients, but also more income for the National Health Service as well. And so that thing around data, not only can it help on the day-to-day running, I believe, of the health service, but also it can really drive that innovation, and that's something that we are really, really focused on, because it's one of the real things that's great about the health service is that we treat everybody regardless of background, but it also means that it's a really great place to test new drugs, and we want access to those here.
Let me just pick up the other two questions if I may. Firstly, the question of where we are for our final moments, where we spend those final moments, is a really important one. And I think by and large, not everybody fits in this category. Most people would rather be at home, in the home environment. And my dad died in hospital. My mum didn't. But it is inevitably more difficult to say your goodbyes, to spend your last moments. It's not to say a hospital, there's nothing wrong with a hospital environment. It's just, my heart of hearts, I know he'd have probably rather been in his own home, and we'd have probably rather been in the home with him, with his familiar things around him in the way that they are at home, but they can never be in hospital. For that to happen, we have to have a sort of home first principle, if you like. And that means building up social care and making sure social care and the sort of care in the community that is available is on the basis of home first, where it's possible to do it. It's not going to be possible in all cases, which you know. And that means that what we're doing on the health service, the NHS, has to be integrated with what we're doing on social care, what we're doing with local authorities. And that's the sort of joined-up work that we're trying to achieve through the missions that we have in government. None of them are going to be within one department. They're all going to have to be across department, and doing the necessary work on social care is a really important priority for us. In relation to preventative work and the allocation, look, some of that, it isn't for us to sort of say where everything should happen. That is for yourselves, for the Trust, for NHS England. But there needs to be a join-up here, I think, to make sure that we have got the right stuff going on, and that where there is good practice, it's being shared. So that is very important to the way in which we want to do business. We're running out of time, so can I just take the opportunity to say just two or three final things. The first is there is this consultation on the 10-year plan for the NHS. It won't take you long. It doesn't have to be complicated. It's not a great thesis. It's not a great exam question. It's somewhere for you to sort of put in your ideas, big, small, and all the sizes in between, as to what would make a difference. What would you like to see done differently? So please make sure that you do that. Secondly, and importantly to us, the day after the election, I stood outside Downing Street and said we'd be a government of service. And that means that we're a government which is in your service. So the opportunity to talk to us, that's not a great gift that we're giving you this morning. That's actually your right. You have every right to tell me and Rachel what you think. You've every right to be heard on this. So we're not being generous, gathering you round to listen to your views. we are actually letting you exercise your rights, because if we're a government service, we should be listening to what you have to say. And for that reason, I don't want you to think this is the only opportunity I'm ever going to get to influence what Keir and Rachel are thinking. And therefore, through the member of my team who organised this visit, we will make sure that we get details to you, so that if there's anything you want to send through that you want me to think about, Rachel to think about, then please use that. And I can tell you, some of I'm one of these people that, on the train on the way home, ruminate about what people have said to me and think about it. So it really is impactful if you do that. So you have the right to tell us what you think. You've got the right to put your fingerprints on the future of your country. Please exercise that right. It's not a gift. It's your right to do it. Then finally, just say thank you for being here and thank you for everything that you do. We really, really appreciate it. Thank you. Thank you.
The Prime Minister and the Chancellor there speaking to NHS staff in Coventry. Of course, that discussion coming the day after the budget, where the NHS saw a very big boost in its spending capacity. Let's bring in our correspondent, Mario Aurora, to get reaction to this. Mario, I guess unsurprising now that the government wants to turn the focus on where the extra spending will go, when most of the focus since the budget yesterday has been on how it will be funded.
Yes, exactly that. I think there's a lot of pressure really around the budget in response to the fact that there's been, a bit of a mixed reception. There's been quite a lot of criticism about, some of the OBR forecasts that have been downgraded, for instance. And this is really an opportunity for Keir Starmer and Rachel Reeves to just kind of try and point people or remind people of the kind of material benefits they will receive, they will, be able to take advantage of because of this huge tax hike that allows them to be able to spend and also invest. We know that some of the investment is coming obviously from borrowing as well. And so this is really an opportunity for them to actually say, yes, we're talking about the tax hike going up to historic levels. Yes, we're talking about national insurance hikes on employers that will, in effect, be passed down to workers, and potential, dampening of, pay rises and potentially reducing the employment rate. However, this is a way you can see your life getting better in terms of your kind of first and second level connection or almost contact, that's the word I'm looking for, with the NHS, and the fact that, the use of AI, tech and digital technology allowing people to potentially be treated quicker and more effectively. But let's just look at some of the questions that they were asked in that Q&A session, because I thought some of that was quite indicative of some of the nervousness or concerns that's coming from clinicians in the NHS. So one doctor was asking about the well-being and burnout of NHS staff, specifically and especially resident doctors, or what we used to call junior doctors. She talked about how staffing gaps, rota gaps were putting patient safety at risk. She also said she was really worried about the winter. We know the NHS always goes through a winter crisis at the moment, and we know that Keir Starmer and Wes Streeting, the Health Secretary, have both said that there is still going to be an NHS winter crisis this year. There will still be people waiting on hospital trolleys in the corridors of hospitals this winter. And Keir Starmer really talked a lot about a mindset change. He said that it was the Labour government's responsibility to stop a kind of disrespectful rhetoric or a blaming of NHS staff for the problems in the NHS. There was quite a lot of nodding and grumbling to that from the group of medical staff around him, and I think that's clearly impacted the way that they work and the way they feel about their work. And Keir Starmer was really, really clear about how he wanted to make sure that that was the first step, was to stop disrespecting NHS staff. Now, obviously, that's not alone going to do enough, but he was trying to say that that, first of all, will be a potential big impact on the morale of staff. Then he was asked about the focus on increased productivity. Now, this is really interesting because we hear governments always, of all colours, talking about productivity, talking about efficiency savings. And we know that NHS productivity is always a bit of a thorny subject, because a lot of NHS staff would say we are already working at past capacity. There is nothing more we can do, as it were. So they were asking about that and saying that actually there's already more pressure to deliver for staff. Now, Keir Starmer admitted he's actually making a bigger ask of staff. He says we've got an ageing population, people are living longer. Yes, I am asking for even more from you. But what he tried to say was that the use of tech and AI would be able to take that pressure off in other ways, and the preventative focus on medicine would make a difference, because less people would then be kind of appearing or presenting in A&E in a dire emergency because they potentially had a preventative solution instead.
Mari, great stuff. Excellent summary of all of the key factors there from Mari Aurora. And after this short break, we're going to put many of those questions, those issues, to the Health Secretary, Wes Streeting, who's just received a bumper new budget to spend on the NHS. We'll be right back with the Health Secretary in a couple of minutes.
Big stories don't always come from big cities. I'm Lisa Dowd and I'm Sky's Midlands correspondent.
You are not getting in this elevator, okay?
The judge made it very clear that she could see no justifiable reason why Sakulas wasn't here facing British justice.
I promised I would get him justice.
Free, wherever you get your news. This is what they're up against. The wind is the really big problems. It is back-breaking work and the smoke is thick. It's been working well. Water levels are dropping, but no one knows what impact further rain will have. What would you do if this place wasn't open? This is the exact spot in Nottingham where their 19-year-old son, Barnaby Webber, lost his life.
I just think it's so cruel and so harsh.
It's really scary. We're terrified.
In this community, I'm told that everybody knows someone affected by COVID.
Hopefully this will be the last wave.
Sky News gets the full story first. Change seems tantalisingly close in this corner of the UK. Wales was the first to introduce the plastic bag charge. It's legal to let go. Set the speed and take the hands off. It's almost driverless, but not quite. Hans is a highly trained police dog. The force is incredible. It's really frightening, actually. This is my patch, my specialism. It's also my home.
Welcome back to Sky News today. Well, we're going to be talking to the Health Secretary in just a moment. We just, of course, heard there from the Prime Minister and the Chancellor. They were at a hospital in Coventry and, of course, wanting to turn the focus on where money's going to be spent from the budget as opposed to how it's going to be raised. And, of course, yesterday, Rachel Reeves announced a £22.6 billion increase in day-to-day spending on the NHS in her budget and £3.1 billion in capital spending. It is the largest real terms growth in day-to-day NHS spending since 2010, if you strip out COVID. Of course, this comes after much debate about whether or not the NHS can get back on its footing. We've heard from the head of the NHS, the Chief Executive, Matthew Taylor, who said it's an important first step towards putting the NHS back on sustainable footing. But he did say it'll take more than one budget. And he says the funding announced today has a lot to do. It will need to cover recently agreed pay deals, growing demand for key targets and to transform services that need to be delivered. Well, we're going to talk to the Health Secretary. Oh, he is ready. Oh, fantastic. Maybe he was already ready and I could have shut up sooner. Well, the Health Secretary, Wes Streeting, joins us now. A very good afternoon to you, Health Secretary.
Good afternoon. I'm always ready.
Well, I don't think you literally were plugged in for at least a minute of me boring our viewers there. Anyway, let me get to the first question, which is what everyone wants to hear, which is you have an awful lot more money to spend on your department all of a sudden. How are you going to mark yourself as to whether you spend it effectively or not?
Well, we've got to do two things fundamentally, which is improve the NHS's performance, start getting those waiting lists down and see some real improvement in patients' experience. I've also got to make sure that the money that goes into the NHS, not just the money that was announced by the Chancellor in the budget, but the money that's already going in, is delivering value for taxpayers. And that's why, as well as the very welcome investment to help us cut NHS waiting lists with 40,000 more appointments every week, or the diagnostic scanners that will enable us to do 1.25 million more scans a year, there are also very important targets in there for improved productivity within the NHS to make sure that we can get the system working more effectively and delivering not just better care for patients but better value for taxpayers, because that's the big challenge I've got, is to make sure that the NHS is sustainable and that it meets its founding promise as a public service, free at the point of use, crucially there for people when they need it.
Do you have a list ready to go of areas that you know need money and will deliver value for money for the taxpayer? I guess my question is, you've been given a lot, especially in these early years. If you aren't confident, will you actually not spend that money?
Well, firstly, the Chancellor has gone through, I think, a very rigorous process in terms of this budget. She's made some big calls. She had a choice about whether to continue with the decline that the country's experienced for some years, or whether to make the big calls to invest and to start fixing the foundations, deliver the change that people voted for. That's what she's chosen to do. And because she has made these big calls, she has also challenged every single member of the Cabinet to make sure that the bids that we put in are things that are going to make a real difference to people's lives. And in my case, those 40,000 more appointments every week, they won't just be more appointments, they will also be reformed ways of working, so that we get more people through using tried and tested techniques at a small number of hospitals to get more patients through more quickly. The diagnostic scanners won't just be more scanners, but AI-enabled scanners. So again, we can get more people through more quickly. And those 1.25 million scans, for example, those extra scans, I mean, that's measured against an NHS waiting list where 1.5 million people are waiting for tests and scans. So you can see the scale of the difference that just that one measure could take. And of course, across the budget, whether it's primary school breakfast clubs to make sure kids are turning up to school with hungry minds, not hungry bellies, the investment in special educational needs and disabilities, which affects huge numbers of people, and I really welcome as a constituency MP, let alone as the Health Secretary. There are things in this budget that will make a real difference to people's lives, at the same time as the investment the Chancellor set out, welcomed by the IMF, will also create the conditions in which Britain can succeed economically as well as anything else.
Do you look at some of the measures that have been used to deliver you that extra spending power and accept some criticism that it's a breach of, maybe not by the letter, but the spirit of your manifesto and many of the promises made in the lead up to the election?
We're keeping all of the promises in our manifesto, despite the challenges that we faced, and we didn't expect to come in with an easy ride. We knew things would be difficult, which is why we were very clear in our manifesto about what we were committing to and how it would be funded, and we're keeping all of those promises. What we didn't expect to come into was the degree of reckless spending and hidden spending that the Conservatives had left us. So we had a £22 billion black hole. So actually one of the first choices I faced as Health Secretary was whether or not I was going to instruct the NHS to go slower on waiting lists. So instead of delivering 40,000 more appointments every week, I was told we couldn't afford waiting list activity, so we'd have to deliver 20,000 fewer. Now, we didn't do that, but that gives you a really practical insight into the sorts of choices that we were confronted with, because that was a very real black hole. The Chancellor's wiped the slate clean and helped us to move forward, and she's made some big calls to do that, keeping every one of our manifesto commitments in the process.
Well, I mean, obviously the OBR report didn't specifically agree with that 22 billion figure, but I think really the central point is not so much that. It's going forward even, trying to claim that working people won't be affected at all by tax rises. And the IFS chief, Paul Johnson, says today the continued pretence that these changes will not affect working people risks further undermining trust. I guess the question is, if this was necessary, then own the change, acknowledge that it does affect working people and apologise accordingly if that's warranted. But that's not an approach you want to take?
Well, we're certainly owning every decision that we're taking. I think the apology that's due is the apology from the Conservatives, who haven't said a single sorry, not just for the state they left the country in terms of our public services or their misconduct in office. They also haven't apologised for the £22 billion black hole. In fact, yesterday the Chancellor published line by line where that figure comes from. If they want to dispute those figures, they're published. We can have a row about that. But it was a very real pressure they left us. And on employers' national insurance contributions, I mean, the Conservatives challenged us before the election. In fact, they attacked us during the election campaign, saying to people, Labour haven't ruled out employers' national insurance rises. Well, they can't say that before the election and then come along this side of the election and say we've broken a promise, because they made it themselves clear that we hadn't made that promise before the election. We did make promises to working people on income tax, NI and VAT, and we are keeping those promises as well as all of the other commitments in our manifesto, despite the challenges the Conservatives left for us.
But it does affect working people, though. Are you acknowledging that?
Well, I think people can look at the budget and they can ask and challenge us whether or not we've made the right call in terms of investment versus decline. People voted for change at the election, and I think they would have been really disappointed if we'd come along and said there's a £22 billion black hole, the public finances are in a mess, and so we're going to go from mismanaged decline with the Conservatives to managed decline with Labour.
That's fine.
Instead, we made big calls to invest and to turn our country around, to fix the foundations, to deliver the change that people voted for. And I think people will welcome what we're doing on the NHS, in our schools, in our transport infrastructure, real things that will make a difference to people's lives and to the economy as well. Because if we can get the economy growing, everything else becomes so much easier.
All agreed, and those choices might prove to be the correct ones, and the economic growth that follows in the next couple of years will be a key factor on that. But have these decisions, do you acknowledge, come at the expense of working people?
No, I think this is a budget that delivers for working people, and I think people will really welcome the investment that we're putting in to the public services that they rely on, as individuals, as families, and as businesses. We've taken real steps to protect particularly smaller businesses, which is why the budget's been welcomed by the Federation of Small Businesses. We've made the big calls to fix the foundations of the economy, and that investment has been welcomed by the International Monetary Fund. And the most important thing after years of Conservative chaos is stability. We've set out very clearly our stall now. It seems to have been welcomed. Not everyone will love every single bit of the budget. I think you'd have to be a miracle worker to pull that off. I'm not sure any Chancellor's ever done that. But I think people can see Rachel Reeves has made the big calls to stop our country's decline, to fix the foundations so we can deliver the change that people voted for.
And just finally, Health Secretary, quick one. Safe zones outside abortion clinics are coming into effect today. It's obviously following legislation passed during the last government. Is this, though, something you're fully behind and support?
I strongly support that. I strongly support a woman's right to choose. And I think women who are making that choice, often a very difficult choice, deserve better than being intimidated when they're going to access reproductive health care. So I strongly support the introduction of this measure today.
Health Secretary Wes Streeting, thanks so much for joining us.
Thank you.
You're watching Sky News. We're going to take a quick break, and when we come back, we'll get the latest from Spain with Jane Sacker.